Joining me now from Washington, D.C., epidemiologist and former Domestic Policy Council lead health advisor to the president, Katy Talento. Katy, I'm trying to drive home the point here, and I know we've heard Dr. Fauci say this, and you as a scientist would back this up. These so-called models are only as good as the data that you put into them, right? And we're effectively in uncharted territory. Well, the models are wrong. A large percentage of these models are wrong. They overestimated, overshot from day one. And I would like to see some of these people held accountable, especially out of the University of Washington. You know, predicting the tens of thousands of people dead within just a couple, 3 months. And now, now they're revising that, oh, you know what, that maybe we didn't exactly get it right. So the difference between March 31st in their predictions and April 7th, today, are well, not diametrically opposite, but they're radically different. How do you account for stuff like this? Is it figures lie and liars figure, uncharted territory? How do we quantify this?
So thank you for having me, Graham. What the modelers in the University of Washington did is they created 4 different scenarios. The scenario that you're talking about with the 2.2 million projected deaths, that is a scenario where no social distancing occurs. If all 4 social distancing measures occur, then they predicted between 100 and 240,000 deaths. So they've revised that down most recently from about 100,000 to now they're at almost 82,000, and that there are some good reasons for this. So one of the reasons why they are improving their projections is because early on, like you said, a model is only as good as its assumptions. Early on, a few weeks ago, the only assumptions that they could feed into that model, the only data that they had to develop their assumptions was Wuhan. Well, in Wuhan, they don't have as great healthcare. They don't have as great ICUs. They don't have sort of more space, more room in their city. It was very densely populated. So they were using that data to build a model for the United States, which admittedly was never going to be as accurate as the days go on and we have better data. So now we're using United States data. We're using Italy and Spain and the British data. So it's a lot more accurate. I mean, it's still projections, it's still assumptions, and only, as Dr. Fauci said last night, all data trumps any model, right? So we're getting better data and the model is getting better. It's good because our healthcare is great here in America, and also we have more room. We have more room to breathe. And most importantly, it is because we are socially distancing. I mean, the flu is down, everything's down, car crashes are down. So we're having a lot better health outcomes based on real data than on projections.
But this is the first time that an entire society has been locked down. In other words, this is the first time we have quarantined young, healthy people. This hasn't happened before. And I want to point to an article out of the National Review. I don't know if you saw this. It was titled, "Has Sweden Found the Right Solution to the Coronavirus?" Now, I've been following Sweden, but I want to read this to you. This is the conclusion of the article. "We've been coping with new viruses for untold generations. The best way is to allow the young and healthy, those for whom the virus is rarely fatal, to develop antibodies and herd immunity to protect the frail and the sick." And this is something I have been pounding on now for a couple of weeks. The fact that when you isolate tens of millions of people in their homes, you are blocking the natural herd immunity that you want to transpire in a society. So when this thing is over, we're going to unleash all these people whose immune systems are necessarily lower and maybe more susceptible to the Wuhan coronavirus and other viruses, when in Sweden, for example, they're allowing this thing to run its course. I have some numbers. Hopefully I can get to them. I want to talk about that. But really, as a scientist, I want to put you on the spot now, Katy. What evidence do you have that this virus in particular, that we are doing anything, mankind is doing anything to bend the bell, bend the curve, affect the numbers? We don't know about this virus. We don't know enough about it to say empirically that, yes, social distancing is having any effect. Do you have any hardcore evidence that says what we are doing is having an effect?
Right. So I think you can compare between locations that have effected social distancing versus those that were late to effect social distancing. The areas that were late to effect social distancing, such as New York City, Mayor de Blasio dithered quite recklessly there. His health advisors were threatening to quit if he didn't stop saying, go about your business and go to restaurants and bars. So in New York is one of the best examples, but there are other examples. The UK also initially took on this same philosophy where let's just let it run its course and develop better herd immunity, which is not scientifically crazy. I mean, you're making a good point, and very rational scientists were thinking that through. What is the best way to handle this new virus? One thing that I think is important to remember, Sweden is healthier than the United States. And when you look at the United States and you say, okay, well, let's just quarantine the people who are at risk and let everybody else go about their business. That's reasonable. People would suggest that. The problem with that, and I think the reason ultimately why the president decided against that and his health advisors decided against it, is because in America, we're fatter, we're sicker, and we have more underlying chronic conditions. So if you look at all the number of people who are Medicare age and above, that is about 60 million people. If you look at the number of people on top of that who are under that age but have at least one chronic condition, we're looking at another 40 million people or so. That's 100 million people who are at high risk for problems and death from the disease.
Right.
It's hard to lock down a third of America and not the other two-thirds.
But remember, it's not the president's locking down America. These are the blue state governors that are crushing the economy and shutting things down. The president has not issued these draconian guidelines. Sweden, to me, though, is the global control group. And I want to try and do an apples and apples comparison. I want to have your reaction. I'm running out of time. But in Sweden, there have been 7,200 cases. They are not doing a lot of testing, Katy. I've got the Netherlands up there first. Can we go to the Sweden slide, Adrian, and then go back to the Netherlands? Let's go to Sweden. 7,200 cases, but they're only testing the sick, Katy. So the number of dead right now is 591, the mortality rate 8%. Again, if they were doing widespread cases of testing, then that mortality rate would be way down from 8%. But now we can go to the Netherlands. The Netherlands has 19,000 cases. This is trying to be an apples and apples comparison. 2,100 dead, a mortality rate of 11%. Your thoughts?
Right. So the Netherlands actually has a much more diverse population. It's far more integrated with the rest of Europe than Sweden. They have fewer controls on their borders than Sweden. So I think Sweden has a lot of good but unique qualities that the other European countries or that the U.S. may not have.
All right. Then again, as the numbers shake out, I'm sure as a scientist and me as a junior scientist, we'd both be very interested in the numbers and how herd immunity is going to necessarily affect the future in Sweden, and in the Netherlands, and of course the United States.
Want to see more videos like this? Click on the link below and subscribe to One American News on YouTube, and call your cable provider and kindly demand that One American News is added to your lineup. Call and subscribe today.